Hi, my name's Sam. I'm a volunteer registered nurse at Avicenna Community Health Center, and I'm here to tell you today a little bit about our clinic so that hopefully you can make the decision to come volunteer with us. First, a little bit about me. I'm a registered nurse and I graduated from UIC's Urbana program with my BSN in 2012. Prior to that, I was an LPN, graduated from Parkland College. I had worked at Champaign County Nursing Home, Champaign County Jail, and I had done some private care duty. And most recently, I was an assistant clinical professor with UIC. Right now, I'm working on my MSN with a family nurse practitioner focus, and I plan to go on to get a DNP. So, on to the clinic. First, we are located 819 Bloomington Road in Champaign, Illinois. That's where Francis Nelson operates, and if you're not familiar with that, it's the corner of Bloomington Road and Prospect, right near the Arby's and the Walgreens. We operate most Sundays from 1 to 4 p.m., but not all Sundays. Our mission is to provide health care for the uninsured and underinsured by providing preventative and curative care while promoting health awareness among the adults of Champaign County. And I truly believe that we are working towards those goals every Sunday. A little bit about the need in Champaign County. Currently, we have a population of about 190,000 people. 23% of them live in poverty, 20% of them do not have a permanent medical home, and 15% are uninsured, and there's an estimated 1,500 undocumented, uninsured people between the ages of 0 to 64. Also, personally, I see a need every Sunday that I'm at the clinic. Our schedule fills up, and we see people who really need our help. So we've got data and anecdotal evidence saying that, yes, there is a need for free health care in Champaign. A question a lot of people ask is, what about the Affordable Care Act? How is that going to affect our patient population? Will we cease to exist in the next few years? And we looked into it, and I'm just going to give you a very short summary of what we found. We found that there will still be potential free clinic patients. Those included undocumented immigrants, those choosing to pay the penalty for no insurance, those exempt from the mandate and who choose to remain uninsured, citizens without documentation, student families, and visitors. We also found that there's a primary care practitioner shortage, and there's especially a shortage of those who accept Medicaid. So there will still be people on Medicaid who cannot find a primary care physician, is what we anticipate. The bottom line is we expect there to be a need for free health care clinic in Champaign, Illinois for at least the next 4 years. So let me tell you a little bit more about the clinic side of our clinic. The services that we offer to patients: we manage acute and chronic illnesses, pre-diabetics, insulin-independent diabetes, hypo and hyperthyroid, hypertension, coughs, constipation, colds, sore throats. We've done some skin tag removal, treated some rashes, and we do a lot of work physicals and physical exams. We also offer nutritional counseling, and our clinic is set up so that every patient, after seeing the provider, has a consultation with our nutrition team. They assess, collaborate, and formulate a nutritional plan for almost every single patient. We're really proud of that. We offer lab work. We have a set of labs that we can offer to patients for no cost, and that's through Quest Diagnostics. We also make referrals. We refer a lot of people to Francis Nelson who are more complex that we can't manage. We also have an ophthalmologist and mental health professional that we refer to. Let me tell you some services that we do not typically offer our patients. Insulin-dependent diabetes mellitus. We don't do TB screening. Imaging we don't do. Psychiatric medical management, including sleep medication and anti-anxiety. We don't do women's health or pediatrics. Everyone must be 18 or older. And Pain management requiring narcotics, we typically don't do. And lastly, immunizations. We typically don't do immunizations, although this past flu season we did have a Walgreens pharmacist bring immunizations, and we were able to immunize about 30 people. As for insurance for providers, I know that's a big question. And let me tell you, our clinic pays for providers to have malpractice insurance, and it's through ISMIE. Some providers take the insurance and others don't. It's really up to you. The limits are $1 million per person and $3 million aggregate per year. Yeah, another thing to note is that you are covered in Illinois under the Good Samaritan Act. Collaborative agreement between nurse practitioners and physicians. We have used a collaborative agreement in the past, and the form is modeled after the form that the state of Illinois produces. So we use that, and our medical director, Shamim Sadiq, is more than happy to enter into a contract with NPs. Right now we currently have one NP with a collaborative agreement, although I think legislation lately has made that null and void, but we still have one for some NPs as they feel more comfortable. Let me tell you a little bit about our staff. We are completely operated via volunteer students, mainly from UI, UC, and UIC-Urbana. A lot of the volunteers are studying to be healthcare professionals, be it nurses, physicians, dentists, public healthcare workers. Our providers are volunteers as well, and they come from Presence, Christie, Carl, Decatur, Chicago, etc. You may know some of them, in fact. Our staff is excellent to work with. They are enthusiastic and hardworking, and they're also very accepting of NPs in the clinic and really welcome your involvement in the clinic. So you may be thinking, this sounds great, I would like to get involved, but I don't want to jump through all the hoops of volunteering, because I know that a lot of times it takes a lot of paperwork or processes to get in, but really we make it as simple as possible for you to volunteer. So if, and I hope you do, you want to get involved, you would either call, text, or email me, because I do the provider schedule, and we would talk about dates. We also have a self-scheduling service through Doodle that I can give you the address, and you can access that and look at who is scheduled when and self-schedule yourself. But oftentimes I end up doing the scheduling just because I talk to the providers via text, email, and etc. So that's acceptable as well. So once we've decided on some dates, you would come to the clinic either on a day that you're scheduled or a day that you're not. We would need copies of your immunizations, license number, MPI number, and one thing to note is that all of that information on you is kept under lock and key. We take your information and your privacy very seriously. So you would turn your immunizations in, license numbers, etc. You would tour the facility, meet the staff, and then get orientated to our paperwork and our processes and referrals, etc. And then you start seeing patients. It's so simple and so quick that every provider that I've orientated, it's been on the same day. So please don't be scared off by the orientation process. It's probably a half an hour, maybe. Myself and Pavan, who's the clinic manager, take responsibility for training and educating the providers on our processes. So we are there every clinic to answer questions, and so please don't let that scare you off. And I want to give you my personal message on this whole deal. Like I said, I've worked at a couple different institutions around town here, and honestly I've never worked with a more loving, hardworking, and positive staff. Everyone who volunteers at Avicenna is passionate about the community they serve and passionate about delivering high quality care. I also know how powerful the NP role is and how much more influential our impact will be in the future. And so it's my personal mission to bring high quality holistic care to the uninsured people of Champaign County, and I wholeheartedly believe that having more NPs at the clinic will help me achieve that goal. It's also my personal mission to introduce NPs as a leadership role to the future of healthcare. A lot of our volunteers are pre-med, pre-dental, or even in med school, and I think they need exposure to our position as a role of leadership in the clinical setting. So that is my other personal goal. I want to thank you for taking time to view this video, and I will have my contact information posted below. And I really hope that you consider coming to volunteer. I hope to hear from you. Please email me with questions or post below. And if you know other nurse practitioners or physician's assistants or physicians who would be interested in volunteering, I would be delighted to talk to them, and I would appreciate you helping me build this network of compassionate providers who are willing to give back to Champaign County, because I do love this city, this town, and the people in it. I really care for it, and I want to do the best that I can for it. So thank you all, and good night.